There's an STD that infects millions of people every single year, yet hardly anyone talks about it. It doesn't get the attention of HIV. It's rarely discussed like chlamydia or gonorrhea. And most shockingly, many people who have it don't even know they're infected. But left untreated, it can quietly damage reproductive health, increase the risk of HIV, and cause long-term complications. This infection is called trichomoniasis. It's one of the most common sexually transmitted infections worldwide, yet it flies under the radar because its symptoms are often ignored, misunderstood, or completely absent. In this video, we're going to talk openly and clearly about trichomoniasis, the signs and symptoms you should never ignore, why it's so commonly missed, and why early treatment matters more than most people realize. If you've ever had unexplained genital symptoms, or if you think STDs always come with obvious warning signs, this is a video you need to watch. Before we talk about the signs and symptoms, let's talk about what trichomoniasis is and some of the ways individuals get infected with it. So trichomoniasis is caused by a microscopic parasite called Trichomonas vaginalis. Unlike bacteria or viruses, this organism moves and survives in the genital tract, spreading mainly through sexual contact. It infects both men and women, but here's the problem. The symptoms are very different, and in many cases, they don't show up at all. They can affect the vulva, vagina, cervix, and other parts of the female reproductive tract, and also they can reside and colonize certain parts of the male reproductive tract, including the prostate gland. In fact, studies show that up to 70% of infected people have no symptoms, which is one of the main reasons this infection spreads so easily. People unknowingly pass it to partners, assuming they're healthy. Now, males and females are affected differently with trichomoniasis. When symptoms do occur in women, they are usually more noticeable. One of the most common signs is abnormal vaginal discharge. This discharge may appear yellow-green, frothy, or thin, and it often has a strong, unpleasant odor. Many women describe it as fishy or foul-smelling, especially after sex. Another frequent symptom is vaginal itching or irritation. This happens because the parasite causes inflammation of the vaginal walls, making the tissue sensitive and uncomfortable. Some women experience burning during urination, which is often mistaken for a urinary tract infection. Pain during sex is also common, as inflamed tissues become more fragile and tender. In more severe cases, the cervix can become inflamed and develop what doctors describe as a strawberry cervix, where tiny red spots appear due to bleeding under the surface. In men, trichomoniasis is much harder to detect, and that's where the danger lies. Most men have no symptoms at all, but they can still spread the infection. When symptoms do appear, they're usually mild. Some men experience burning or discomfort during urination or ejaculation. Others notice a thin penile discharge, often clear or slightly cloudy. Mild irritation or itching inside the penis can also occur. Because these symptoms are subtle or short-lived, many men ignore them or assume they'll go away on their own. Unfortunately, even when symptoms disappear, the infection can remain active and transmissible. One reason trichomoniasis is rarely discussed is that it doesn't behave like other STDs. It doesn't always cause pain, it doesn't always cause discharge, and it doesn't always show up on routine STD screenings unless specifically tested for. Untreated trichomoniasis increases the risk of contracting and transmitting HIV by causing microscopic breaks in the genital lining. In women, it has been linked to pelvic inflammatory disease, pregnancy complications like preterm birth, and infertility. In men, chronic infection can lead to inflammation of the prostate and urethra, contributing to long-term discomfort and reproductive issues. For treatment, the good news is that trichomoniasis is curable. Diagnosis usually involves a lab test using a vaginal swab, urine sample, or penile swab. Once identified, it is treated with a specific antibiotic, most commonly metronidazole or tinidazole. Treatment is simple, but both partners must be treated at the same time, even if one has no symptoms. Avoiding sex until treatment is complete is essential to prevent reinfection. In conclusion, trichomoniasis is the STD almost no one talks about, but it shouldn't be ignored. It's common, it's often silent, and it can have serious consequences if left untreated. The lack of symptoms does not mean the absence of harm. If you notice unusual genital symptoms, or if you're sexually active and haven't been tested recently, speak to your doctor as soon as possible.